Hello, CAC2 colleagues. This is Joanne Salcido. Thank you, everyone, for joining us for today's webinar. A special call out to Robin French for leading the technology side of things with highly appreciated backup from Scott Gilman. Thank you, everyone, for logging in. We are a big and today widely geographically dispersed family today, with members on the line from at least 19 states, this is old data perhaps, representing at least 22 organizations, one company, and we're also joined by several individual members. So again, welcome everyone. Quoting our esteemed leader and president of CAC2 in her email to us last Friday, February may be the richest, most valuable monthly announcements we have ever put together. So clearly, you all have read her email since you clicked on the webinar registration link. Congratulations, thank you. And you may also have noted that results are in from the member polling in support for the CAC2 think tank proposal, the one titled Exploring the Potential Ethical Issues and Best Practices for Childhood Cancer Charities Funding Research. The project team will soon be hard at work, so be ready to jump in when they invite us to participate in various ways. I'm going to start off with some few housekeeping and instructions before we invite our speakers to take over. So your microphones are muted as a courtesy to everyone, and questions will be deferred to the very end of the session after both Ruth and Danielle have spoken. You can pose a question by typing it in on your webinar dashboard, and I'll read it out loud for Danielle or Ruth to field. If there is a technology problem, please send an email to webinar@cac2.org. Please note we're recording the webinar today, so we'll process it and post it on the CAC2 website as soon as possible for viewing at your own convenience. Finally, we do value your feedback. We need it so that we can keep the webinars meaningful for all of you. So when you see, we'll be sending out a brief survey after today's presentation, so please provide input. If we move on to our CAC2 value side, thank you, Robin. Before our speaker gets started, I want to kick us off with the reminders of our shared values as a coalition. Always important to keep these at the top of mind every time we start. We put the children and their families first in everything we do. We are supportive of each other's efforts, mindful to not duplicate efforts or compete. We take ownership of our commitments we make to each other, and we're good stewards of resources. In our aim to give voice to the childhood cancer community in a coordinated way, we are action-oriented, and I can't think of a better webinar topic than today's to prove that. So without further ado, if you can go to the next slide, Robin, okay, keep there for a moment. Ruth, who I'll introduce in a moment, will speak first, and then Danielle. So it is my pleasure to introduce our first speaker, and my regret, though, that I can only scratch the surface of her experience and accomplishments. But since 1999, Ruth Hoffman has been the CEO of the National Office of the American Childhood Cancer Organization. She's also served as the president of Childhood Cancer International and is a member of the steering committee of the World Health Organization's Global Childhood Cancer Initiative. Ruth received her bachelor's degrees in psychology and in education from the University of Western Ontario in Canada, and a master's in public health from the program at George Washington University. She's the author of several books for children with cancer, their family members, and school teachers, and will now tell us all we need to know about International Childhood Cancer Day. Welcome, Ruth.
Thank you. Thanks, everyone. So first, I want to thank everyone for attending, and those are Danielle's slides, so we need to switch to my slides. For attending today and for having an interest in International Childhood Cancer Day. So next slide. So next week, next Friday, February 15th is officially International Childhood Cancer Day. The day was founded, as you can see on the slides, in 2002 by Childhood Cancer International, and it's celebrated around the world. And you're thinking, okay, so what is Childhood Cancer International? Childhood Cancer International was founded in 1994, and it's an umbrella organization, a lot like CAC2, of national member organizations around the world. There's 171, again, parent-driven member organizations in 88 countries. We're committed to working with international partners, and that includes the World Health Organization, SIOP, and others, towards the global goal of reducing childhood cancer mortality and morbidity. We actually just submitted a year ago an application to the World Health Organization to be in official relations with them, and we received that approval last January. And so very exciting to be working hand in hand with the WHO on many child cancer issues. ACCO is the U.S. founding member of Childhood Cancer International, and I currently serve as the CCI president. Next slide. So this is actually the basis for CCI and the global childhood cancer movement. It's basically the opposite of childhood cancer survival in high-income countries. So if you look on the left graph there, you can see that actually 80% of all children with cancer in the world live in low to middle-income countries. So 20% live in high-income countries like the US, Australia, Europe, and actually just parts of Europe. And then there's also huge disparity in terms of survival, where high-income countries have an overall survival of more than 80%. In low-income countries, it's the opposite. It's the flip again. Less than usually 20% survive. So each year, globally, there's approximately 300 children ages birth to 19 that are diagnosed around the world with cancer, and about 8 out of 10 of these do pass away as a result of the cancer treatment. And there's many reasons for that. One of them is a huge lack of access to essential medicines, which is one of the things that I work a lot on. Next slide. So one thing that happened in the last few years, in order to be in official relations with the World Health Organization, we had to do in-country work. And so Childhood Cancer International was working closely with the WHO for 5 to 8 years, actually, and we were working a lot in Myanmar, Ethiopia, and Ghana. And as a result of that, it led to the WHO's greater interest in childhood cancer. SIOP, which is the sort of the global equivalent of the Children's Oncology Group, was also working hand in hand with CCI. And that actually led to a very exciting announcement on September 28th of last year at the United Nations General Assembly that the World Health Organization was actually launching a new global initiative on childhood cancer to address the disparity between survival in low middle income country versus high income countries. And very excited to really tip my hat or commend St. Jude Children's Hospital. They actually provided $15 million to the World Health Organization in order to do this. And so that has actually elevated childhood cancer at the WHO level to, a new height. Prior to that, their international global budget was $20,000. So we went from $20,000 to $15 million. Next slide.
Ruth, can you hear me? This is Joanne. You're skipping out a little bit, and it could be from your computer audio. If you can maybe stay still at the mic.
It's probably because I move when I talk, but I will try really hard. Thank you. So with this new global childhood cancer initiative, there's really 2 overall arching target goals. One is to achieve at least a 60% survival for all children diagnosed with cancer around the world by 2030. Currently, it's the global survival rate is around 20%. So this would triple the global survival rate. Double to triple. And it also would account for saving an additional 1 million children's lives over the next decade. And then the second goal is to eliminate all pain and suffering of children fighting cancer. And I can't, emphasize enough that second goal as well. Just having traveled around the world, seeing children with cancer, so many of them, and the majority of them in low middle income countries die from their disease, and they die in pain, often without even an aspirin, with metastatic disease, no access to morphine, or any sort of pain control. Next slide. So I just want to show you here, and we will get into, how this rolls into International Childhood Cancer Day, but I really wanted to give you the overview of the WHO initiative. So this is the 5 overarching working groups that are working on childhood cancer, this global childhood cancer initiative. You can see under working group 1, that's really focused on policies. I work very closely on working group 2, which is access to essential medicines and technology. There's 3 subgroups in there: access to essential medicines across the value chain and the barriers to that access, secondary barriers to access to diagnostics and therapeutics. And then the third piece is nutrition. And again, in low middle income countries, it's a very different world. There's not, basic diagnostics. There's no infant scales. There's no study meters. There's no even basic tape measure to measure, a child's mid-upper arm circumference to, determine body mass. And in low-income countries like India, Myanmar, 7 out of 10 children who are diagnosed with cancer are also malnourished, and 3 out of those 10 children will die from malnourishment, not from the disease. So there's a huge initiative on the global, front to work towards increasing access to the nutritional needs of children with cancer as well. And then you can see, again, working group 3 really focuses on more the service delivery, medical twinning and training of doctors and hospital staff. The working group 4 really works with registries in hospital, as well as national and international registries. And then I also work in working group 5, which really focuses on advocacy and information and getting the message out about these new global targets and International Childhood Cancer Day.
Ruth, sorry to interrupt one last time. We want to catch your every word, and we're willing to take a little stop here. If you would dial in instead,
Sure.
Can you follow me right now?
Yeah. Okay, so then I have to go to phone call, and I'll call in.
Yes, you can go to the audio part on your dashboard.
Yep.
Select phone call. The number is there. If it's hard to spot, it's also in the text I sent you. So go ahead, take your time. We're good. We'll just...
Sorry.
It's okay.
Okay, so 213-929-4221. I'll call it.
Great. And then at some point, once you're on, you'll want to turn off your computer audio, but so far so good.
Okay, hold on. 211-341-374 #. Okay.
I think you're in. Turn off your computer audio so there's no echo. Go into your dashboard.
Can you hear me now?
Under audio.
Oh, yeah.
Yep.
And there's a choice of phone or computer, and you just switch from your computer to the phone.
Guys, it
Okay,
sounds
can you
perfect.
hear me?
I think we're good to go. Yep, good to go.
Great.
Okay,
Thank
good.
you.
Okay, I'm sorry about that. Do you want me to repeat anything or just keep moving forward?
Why don't you finish out that last part, the working group 5?
Okay, so working group 5 really looks at the messaging that's coming out of the World Health Organization with regards to this whole initiative, and then those target goals of, increasing childhood cancer survival and reducing and eliminating pain and suffering. So next slide. So one way that we're doing that is through the 2019 International Childhood Cancer Day campaign. And so we've taken those two concepts and we've created assets to build on that messaging. So the hashtags are no more loss, and then also no more pain and suffering, or no more pain. So as you can see here, we produced, and it's actually ACCO's team that produces these materials and assets for the WHO, and then they distribute them and use them on their social media, and they share, again, the stories that we're collecting, which I'll talk about in a little bit. And then we also distribute these materials through a toolkit that's downloadable on the ICCD website, and it's www.International Childhood Cancer Day. It's all written out. So that toolkit is there, and it has all these materials in it. So next slide. This slide really speaks to the no more pain and suffering. The stats that are on these posters actually come from a WHO document that was just published last year. It's a WHO guide on pediatric palliative care, and it's predominantly for healthcare providers. But again, the stats are pretty astounding. So as you can see on the poster that we've done on the left, 90% of children that live in low middle income countries experience serious health-related suffering. And that equates to 2,500,000 children each year. And then on the right, again, this is the whole focus of the access to pain medications and opioids. And if you look there, what we're doing, I mean, we heard on the State of the Union last night that the opioid crisis in the United States, in low-income countries, the opioid crisis is the exact opposite. They have, just a desert of access. If you look down here, Uganda, doesn't even have, 1 milligram morphine equivalents per person in that country. And so another aspect of the abuse that is happening in America and high income countries actually contributes to the lack of access of opioids and pain medications in low middle income countries. They don't want to get into this sort of mess. And so, barriers are put in place by government and institutions so that there's not abuse of opioids. And I don't think we think about that, right? We think about, it's a crisis for America because, there's overdosing and there's this and there's that. And that's true. It's an enormous crisis. I mean, you can see here in 2015, people in the United States consumed on average 677 morphine equivalents milligrams per person. I mean, it's just an astounding number. But what we don't ever hear about is the consequence of that and the rollout to children with cancer and children and adults in other countries who are dying of disease and pain. Next slide. This is the book the guide on the left that the WHO released. It's the first integrative palliative care guide and symptom relief for pediatrics. It's not specific to childhood cancer, but it is specific to pediatrics. I'd highly recommend reading it. And then on the right is another poster that ACCO produced. Again, just bringing this into reality. The cost to cover morphine equivalent pain treatment for all children suffering from serious health-related suffering in low middle income countries would be $1 million a year. That's 63 cents per child, and it doesn't happen. Next slide. Again, just more graphs that we've produced for ICCD this year for 2019 and the 3-year campaign. We do have this No More campaign as part of a 3-year campaign. Last year, 2018, it was No More Complacency. This year is No More Loss and No More Pain. And next year, I'm pretty sure we're going to focus on No More Borders. The next slide. So how can you get involved? building awareness in your community. You can download the assets that are located here at International Childhood Cancer Day. I would encourage you to look at them. A lot of the posters have been produced in different cultures. So there's an Asian slide, there's an African slide, there's Caucasian slide. It's country specific. There's other country specific data in terms of comparing access to morphine equivalent access. There's a video in there on pain, and again, it can be used universal. But I would encourage you to look at that. We also have developed Facebook frames, and there's press releases, graphs, posters. Everything is there to use on your Facebook or in your community or with your local representatives. Next. And then share. So one of the things, the hashtags, as you can see, is hashtag no more pain and hashtag no more loss. And so one thing that we're collecting is personal stories of hope and healing. Loss does not necessarily, as you know, mean just loss of life. It's loss of limb, it's loss of childhood, it's loss of family structure, it's loss of routine. There are lots of losses connected with childhood cancer. But what we really want to collect is also, and share, is stories of how families, go through this loss and how children, go through the loss, and not, actually when we put this out there, I said triumph over it. And it's not, we didn't mean, how do you triumph over the loss of a child? You don't. So it's really about sharing stories of hope and of healing, to, give hope to others that are going through this journey. Next. There's the Facebook frames, and they're made up of the gold ribbons rolled around and the International Childhood Cancer Day logo, which is also on the toolbox or the toolkit on the site. And next. There's some more examples of the Facebook frames. Next. And then really, again, share. It's about sharing. It's about caring for this cause and sharing how you celebrate International Childhood Cancer Day on social media and your community. And I would encourage you to do that. Contact your representatives. Let them know that today is International Childhood Cancer Day. Let them know that, President Trump in his State of the Union, launched childhood cancer and a $500 million commitment to it. For those that heard that last night, it's very, very exciting. That helps to elevate this cause, in each of your communities. Share your stories, your personal stories. Ask them to support this, local, national, and global childhood cancer issue. And then, I would, raise your voice, share your stories. And if you want to share them, on your own social media, you want to share them with International Childhood Cancer Day's Facebook page or Childhood Cancer International's Facebook page, that would be absolutely wonderful. Next. That could be it.
I think that is it, yeah. So go ahead and you can put Danielle's first slide. Wonderful. Thank you, Robin. Thank you, Ruth.
No problem. I will mute.
Boy, it's really wonderful. Of course, we have to stay focused in our communities and our populations, but it really is nice to broaden our mind and open those borders and realize that, a child anywhere should not be suffering from cancer. So thank you for keeping that top of mind. I'm going to now introduce our second speaker who's going to close us out. I should say we're going to have a Q&A at the very end. So please, people, if you have any questions for Ruth, please jot them down. If you're like me, I won't remember in 20 minutes. And you can pose them then by typing them into your dashboard under chats, and I will read them. And just telling me, if it would help if you tell me if it's for Ruth or Danielle. So thank you. So again, it's my sincere pleasure to introduce our second speaker. And again, in a few words, I can hardly convey the force for good in action that is Danielle Leach. Danielle serves as the co-chair of Alliance for Childhood Cancer, as well as on the Pediatric Hematology and Oncology Family Advisory Board at Children's National Medical Center, in DC. She's also Senior Director of Advocacy and Government Relations at St. Baldrick's. Danielle holds a Master of Public Administration degree in Health Policy and Management from New York University. She's driven by her desire to create change for kids with cancer, and she has outstanding expertise and experience pulling groups together for action, including all things Action Days 2019. So welcome, Danielle. Thank you.
Thanks so much. So we are going to hear next slide. We can jump to the next slide. It is March 26th and 27th of 2019. And why is coming to DC important? And, you know, it's good to kind of think about it again as to why we need to all make the effort to be here in DC and show solidarity for kids with cancer and their families. Because if you're not at the table, you're on the menu. And if you can't win if you're not at the table, you have to be where the action is. And we need to make sure that we are always at the table when cancer is being talked about, as well as childhood cancer is being talked about. Next slide. So why so early this year? And we've gotten some feedback from people. They're like, why are we going almost a month and a half earlier this year? Well, this year is all about appropriations. It's all about getting more money for pediatric cancer. And the deadlines for language are pretty much early in April, although some of this might be skewed a little bit because of the shutdown. But we really felt it was important. It wasn't as valuable to have people come in May after all the appropriations language was written and had to be submitted. We really felt like we wanted to have everybody on the Hill during appropriations time with a strong message about funding. Next slide. So these are the key committees and with whom we work and that are the focus. This year, obviously, appropriations is one of our main focuses, and we'll talk about that in a moment. But you know, we always continue to have the House Energy and Commerce and the Senate Health Committee always have decisions around pediatric cancer and health and research. So individuals from those states and districts are very important to participate in Action Days. Next slide. So these are the important states. Again, everybody is valuable to come to Action Days, but especially for us to have representation from these states is critically important, especially with those with the stars. So, you know, for example, like West Virginia and Rhode Island, we have champions, Capito and Reed, but, you know, we sometimes tend to not have people come from there. And it's really important to even thank our champions and to have them feel like their constituencies really value what they're doing in pediatric cancer. Roy Blunt and Patty Murray, Missouri and Washington, and their heads of appropriations. It's, you know, again, Alabama, Richard Shelby, are going to be critical to have a good contingency from those states. Next slide. And these are the important districts on the House side. Nita Lowy from New York, Rosa DeLauro, and you can see there, and I know you guys will have this later on, but this is a good guide. So if you have advocates or supporters from those areas, we strongly encourage you to get them to come to Action Days. Next slide. So there's new things this year, and we just wanted to, let you know that you spoke and we listened, and we wanted to, every year we get feedback about Action Days, and we wanted to make sure you all knew that we are listening, and we're trying to always improve the experience. So to ensure all advocates have a good experience on the Hill, we know that you invest a lot of time and energy and money to come. You are going to be asked to sign an advocate agreement when you register that has core advocacy, core principles about coming to Action Days that we hope all of our advocates will abide by when they come to the Hill in collaboration with the Alliance for Childhood Cancer and the organizations that are there. The format in the afternoon will change a bit. For those of you who've been there before, we're going to be seated by state from the beginning. We're going to have more practice and rehearsal of asks in the afternoon by the groups. And, we've asked for more, we've been asked for more social time. So we're actually, instead of having a working lunch like we normally do, we're, for the training day, we are actually going to have be a little bit more social and have the opportunity for advocates to connect with one another. Next slide. So, I'm talking more about logistics, but these are the things that come up. So I want to make sure people understand some of these things. The hotel is in Arlington this year to keep the costs lower. The Alliance for Childhood Cancer, on the registration, just on the hotel site, you'll see the number 249, and there's lots of reasons why Marriott can't take that to the actual number that it's going to be. It's a $209 a night. The Alliance subsidizes $40 for every night at the hotel. So again, we're trying to keep the costs down for everybody. Please book early and so that you can get a room at the hotel. It's right by the Reagan Airport, which has a shuttle to the hotel, so that helps keep the costs down for travel. And I know this is difficult for some areas, but please try to not make your flight home earlier than 7 p.m. on Wednesday, if possible. There'll be a limited number of hotel rooms for Sunday night and Wednesday night if you're needed. And if you have any specific issues, just call, or contact the Alliance at asco.org, and they will, the team, both Ruth and I, are on the events committee and do a lot of the logistics, and we will make sure that your questions are answered. Next slide. So scholarships. As always, we have donors and supporters that are able to provide scholarships to advocates to come. There is, again, encouraged to apply as soon as possible. We will let everybody know by the last week of February if they've been chosen for a scholarship. The link is on the registration page. The priority is going to be given to states and districts for appropriations first, and then ENC and HELP. And then if we have money left over, which I will say honestly right now probably isn't going to be very much, but we're going to try to get more supporters to invest in scholarships. We hope we can provide a lot. Usually on average, we provide about 20, 25 scholarships in addition to the subsidy of the hotel rooms. So the kids room, and I just want to make sure that this is clear for everybody. It's available for children ages 4 to 12. If you have children under the age of 4, we ask you to arrange your own childcare. If you have an issue and you need help finding childcare, we can, try to help you. Some of us are on the ground locally here. You can't bring your children under 4 into the training room just because we've had issues before with kids. Just, it's hard to stay still all day, and people are there for the training. And then the kids room is also run by child life specialists, and they do an amazing job, and we want to make sure that everybody has a good experience in there for the kids. Next slide. So accommodations, if you need special arrangements or accommodations, we can't help you if we don't know. It's a long day, and if you or your child are in active treatment or you have survivorship issues or mobility issues, we can arrange support or a wheelchair. We can also accommodate the schedule. So box schedules, and they sometimes leave a little bit more lead time in between appointments. Sometimes we can arrange for an escort so you don't have to go outside. You can go under the tunnels, things like that. With help and forethought, we definitely can make it as easy as possible if you need help. The buses are handicap accessible. Next slide. So there are sponsorship opportunities to help support Action Days, especially help with scholarships, as I mentioned, and you can contact the Alliance for more information, and we would love to have more collaborative partners to help make this day a success and to get as many people as possible to the Hill, especially this year. Next slide. So getting ready, if you decide to come, and I know many of you already do come on, we have lots of people who come every year. There's a couple things we want people to do to get ready. We want you to prepare to share your story, recruit your team at home, learn about your legislator. We'll talk about our asks and the digital advocacy and getting your gold gear to get ready. Next slide. So this is the general logistics, just so people have a sense of what's going on. Tuesday is the training day. Please be aware, and you will have signed in the advocate agreement about the use of photos and video. kids' room again. Details, lots of breaks are going to be provided. We try to make it as fun as possible on training day. We're going to have some really good speakers, and it's shaping up, obviously, to be pretty exciting. And Hill Day, we are right now, breakfast is provided at the hotel. We're going to take the, take a photo on the Capitol steps. We're going to have something at the Methodist Church to put bags in, because you can't lug your bags around. If you want to bring your bags to the Hill and leave straight for the airport, we're going to have a kickoff on the Hill, and then you'll be getting meetings all day. And we ask that you do lunch on your own with your teams, and we'll provide an Uber code to travel back to hotel. Next slide. So preparing to share your story. Your story is the most important part of your meetings. This is really important to practice, but especially if you are in larger states, on how to keep your story brief, because there's, often everybody wants the opportunity to talk about why they're there or why this issue is important to them. So practicing that with people prior is really a good way to hone your message and kind of do your elevator speech around pediatric cancer and your story. Next slide. So learning about your legislators, if you don't already have a relationship with them, take some time to go on their bios, follow their social media. We're going to give you information about how they've supported childhood cancer legislation in the past. At the training, obviously with the STAR Act, it was passed unanimously in both in the House and the Senate. So it's we can at least say that. We know that that's all of them have supported it. Please, if you have relationships with an office or a staff member in an office, please indicate that during registration so that we can make sure that Soapbox is aware of that. And it definitely enhances your meetings, and we can let the staffers know. They hate when they know that a constituent that they have a relationship with has been made an appointment, and they kind of get caught off guard. But you can also let that office know you're coming if you have a contact there. Next slide. So our asks, we're going to be focused on appropriations for both the STAR Act and NCI NIH funding. I think, as Ruth alluded to, the State of the Union mentioned childhood cancer being a national health priority, and there was a commitment to put something in the, $500 million in the president's budget over the next 10 years. We don't have the details of what that looks like yet, what that is, how that works. That is something that we're going to be analyzing over the next couple of weeks, and hopefully we'll have more information before the federal budget comes out, the president's budget comes out in the next couple of weeks, and we'll have a more vision of where it's landing or where they envision that money going. And then we will determine with our team and the policy committee how that fits into our traditional asks. As you know, the STAR Act is funded for $30 million a year for 5 years, so $150 million over 5 years. But every year we have to go and ask for that $30 million. We may ask for more now because of the State of the Union. Who knows? But we're going to figure out the ways to leverage that highlight of at the State of the Union, and what can we do to leverage that opportunity as much as possible. We will have another ask that's to be determined. The policy committee meets every month, and we have some legislation in one particular in palliative care that's in PCHETA that might be the third ask. But again, we're in the process of looking at the environment, looking at what's moving right now so that it's relevant. But the STAR Act and the money related to that is critically important because they are already implementing it, and we're seeing the money go out the door. So we want to make sure that they have the way to continue it. You will have supportive materials to review, and like I said before, you're going to have plenty of time to practice with your group. Next slide. So digital advocacy. If you can't attend in person, this is your chance to activate your networks from home. We will send sample tweets, hashtags, Facebook posts. We typically do that in coordination with CAC2 and make sure that you have all the materials as well. So there's Alliance members that are both CAC2 members and Alliance members. Prep your networks that you're coming to DC. The biggest push, we're asking is when we are on the Hill, people making phone calls, taking photos when you get on the plane. Tell a digital story while you're on the Hill. That always, what we find, and as probably many of you know, is that engagement on social media is much higher when you have a photo or a video. So the more that you have, and we know that Twitter is obviously a powerful tool that the Hill uses and pays attention to, so that's something that we want to use effectively. Next slide. So getting your gold gear. So if you are attending or if you're at home and you want to take your social media pictures as well, we encourage you to wear gold ties, scarves, ribbons to represent our cause. Please try to stay away from the super yellow gold because it gets confused easily with the military ribbon by the Hill. So more of the metallic if possible. And please stay away from wearing organization-specific gear as we try to show a unified voice on the Hill and not organization-specific, but just as a community together. Next slide. So Faces of Childhood Cancer. If anybody has gone to Action Days, you know the long and essentially a huge wall of children that we display at the training. But this is a really effective tool that we use when we go to the Hill. We put these in the folder that we leave behind at all the meetings so that the member of Congress can see people from their districts, children that are from their districts that are affected by pediatric cancer and their stories. And we want them to understand and see that this is real children where they live that are being impacted. We'll be sending an email with links and more information about the Faces sheet. Last year we had created an online form which we felt was really, we got a lot of good positive feedback that it was easy to use. You can share with your networks in the childhood cancer community to get them to fill it out about their children. And if you cannot attend, please fill out the form and we'll include and print them for your legislators' packets. Because we do not only in the meetings, for all the meetings that we actually have, we actually drop off packets to every member of Congress after that day. So the third day, we have interns come and cover all the other offices that we may not have had advocates at. Next slide. So as always, Soapbox Consulting works with us to help schedule your meetings. They just updated their mobile site to manage their schedule. You're going to get push notifications when there's a change in the schedule. It's actually some updates and more functionality to their tool. You'll get an email the Friday before Action Days from Soapbox with the link to your schedule. Any issues will be addressed on the Tuesday. We in Soapbox are here for you to have the best experience possible. And if there are issues with your team, you're going to be provided with a call number that day that we can hopefully help you, but hopefully with the advocate agreement and some understanding of expectations people experience overall on the day. Next slide. That's what the schedules kind of look like. We indicate the committees, what they've done, and they're going to, we'll have more details about that when Soapbox presents at the Action Days, what all these codes mean. Next slide. So this is, kind of silly, but it's true. Wear comfortable shoes. Feel free to wear sneakers and bring other shoes in your bag. Do not stress about what to wear. There's business casual on the Hill. You'll see everybody walking in all different forms and fashions. And like I said, do not bring large backpacks or luggage to the Hill. If you have time, you can leave at the hotel or at the room we'll have at the Methodist Church. And, that's, to encourage you to register today. The more time that we have to prepare the teams and get the schedules in place, the better it is for everybody to have the most effective days possible on Action Days. And this is a really critical time, like I said, to ensure that continued support for funding and to optimize on the opportunities that have been presented recently. We need to have a strong showing on the Hill in March. So we hope that you take some time and come to DC. Thanks.
Thank you, Danielle. Big round of applause, if you can imagine, coming both of your ways. So thank you for your efforts and your just unending energy to keep this issue at the forefront. And urge everybody to do what they can to be a part of that. In March, I too was thrown away a little bit by the early date, which is partly why I was slow to get this webinar on, so my apologies, but information is just in time. Wonderful. Very specific, explicit information and encouragement. Wonderful. And if anybody wants to revisit this, again, you can listen to the video recording after today. Lots of great nuggets internationally and nationally. We have still good time for some questions if anybody has any. Please type them in. It looks like someone might be having something in the chat box. I don't see it quite yet coming up, but it makes its way up. So let me ask one quick one that came on the top of my head, Danielle, vis-a-vis implementation of the STAR Act. What's the best way for us, or how do you stay updated on, in fact, how those dollars or where those dollars are being distributed? Any help with that?
You know, I think we're going to be giving you an update, but I think we shared when the RFA and a lot of the members of both CAC2 and others shared that the RFA went out from NCI around survivorship, which was in record time, from 6 months, $5 million for survivorship research. The RFA went out about 3-4 weeks ago, and that's out the door. And so that was really important. The way that we, encourage people to stay apprised of what's happening is, we try to communicate with your advocacy team and push out information as we get it. There's a lot of moving parts. CDC is also, working on implementing and expanding existing programs based on the money they're receiving from from the STAR Act, and they're actually, both of those agencies will be at Action Days to report out some of that to everybody at Action Days. So we'll continue to make sure that that's available to everyone as we learn about.
So
Great.
Danielle, that's exactly right. I'd also like to tell the folks who are listening that that as part of the program for the annual summit in June in Columbus, Ohio, CAC2 members will hear sort of updates that will help contextualize what you just said, about what's going on in the biorepositories and data, what's going on in survivorship, just because it's very important in our community for us to realize that getting the legislation and getting the appropriations is hugely worth celebrating, and it was a heavy lift and something that we all appreciated, but we don't want to just walk away. We do also want to pay attention to the way that our interest in the STAR Act and in the Race Act and so on are being implemented and carried out, and so we'll plan to have that as part of the program as well in June.
Thank you for highlighting that, and people probably recognize that was Vicki Binger's voice. Thank you, Vicki. I have a question. Someone's asking for the registration costs, and I assume that means for Action Days. Is there such a thing as registration costs?
Yes, what we did several years ago, because we actually had some issues with people not showing up, and that actually was a huge cost issue for us as a coalition. We have asked individuals to, it's $50 per family, and if you're an individual advocate, it's $50. We are, amenable and talk and keep in close contact with people if they wind up having to cancel. We ask, I think, 2 or 3 days beforehand. If you have to cancel, that's fine, and we can, work with you on that. But we really had to put that in place in order to make sure, because again, it's respectful to the other people who have signed up. It kind of threw off a lot of the groups and everything when we had people not show up. And so we didn't get, when we implemented the registration, it actually helped ensure people felt committed to coming. And also that money is often used to support scholarships.
Got it. Thank you. We have a few minutes left. Any other questions? Please type them in. I also want to invite Danielle and Ruth, if there's something else that you had wished you had said while you had the mic during your presentation and you didn't get a chance to comment, please feel free to chime in now as well. Otherwise, we can close out soon. We don't need to take the full hour. I want to thank you both. You do not have this time. It magically appears in your calendar somehow, and you grant us this time on the webinar. So it's very, very appreciative. We join in celebration together with all the great things you have mentioned, but heed your call to action and to never slow down, especially when it feels like there's so much to celebrate. We can take a breather. We need to move on rapidly. So thanks for your continuous leadership in this advocacy area for all the children we serve. And with that, unless someone nudges me with a text or a chat or a question, I think I can close out. Again, thank you to both of our presenters. Onward, everybody, with our respective missions in voice and action. Hopefully we'll see a lot of each other in D.C. and enjoy the rest of this beautiful day and week. Thank you. See you soon on the next webinar. Okay, bye-bye.
Bye. Thanks.